Hey guys, my name is Diane Hammonds, and I'm going to be talking to you about treating an individual for gambling addiction. And we'll do that using cognitive behavioral therapy. Okay, so these are assessment tools that we want to use to screen somebody for gambling addiction. It's simple, you just want to stick to the DSM criteria using the structured clinical interview. You can use a South Oaks gambling screen that's going to gauge intensity of gambling behaviors. Addiction severity index. This one is good. There are lots of personalized ones. So they have an addiction severity index for gambling, for alcohol use, for marijuana, for a bunch of different types of addictions. That measures quality of life impact. So some people can hide their addiction. Their family members don't know. Other people have done jail time because of stealing to get money for this or that so that they can engage in the gambling. It's different for everybody. This is going to measure the impact on their current life. And then this one's really important, brief symptom inventory. This is going to measure the amount of psychological distress they're in when they're first coming in to work with you. This is super important because it's going to, it can clue you into any possible mental health diagnoses. It's going to help you understand their current level of functioning and where they might need extra mental health support right out the gate. That way you can coordinate mental health treatment and substance abuse treatment or gambling addiction treatment. Level of care recommendation. Ultimately, we're going to recommend CBT weekly sessions with a therapist. In the studies that I read, there were 3 control groups. One group just went to GA. That was ineffective. The second group did a CBT workbook at home without any coaching or therapy. That was ineffective. What was highly effective was in-person CBT sessions with a therapist. So that will be our level of care recommendation across the board, but especially for the lady that we are treating. Also, I just want to make a note. So GA being ineffective, I don't think that means that GA is invaluable. I think it just means that reducing problem behaviors, in order to do that, you have to take a behavioral approach and address the classical conditioning that has occurred to help create the addiction. And when you're in GA, or Gamblers Anonymous, it's very valuable for building social support, receiving validation, and improving insight. But you don't get deconditioned there. So that's not to say GA is not valuable, but that it doesn't work. Literature shows that it doesn't work at reducing problem behaviors. Problem gambling behavior, sorry. Okay, so theoretical frameworks. Abstinence-based frameworks have proven through literature to be ineffective for reducing gambling behaviors. So to take the approach that says, never go to the casino again, don't be around any of your triggers. If you see a trigger, run away. That it just has proven to be ineffective for people, and it doesn't stop their gambling at all. But the harm reduction approach is said to be very effective. That actually says the opposite. It says go to the casino, work on gradually exposing yourself more and more. But as you expose yourself, don't reward yourself in the way that you usually would by playing the slots or scratching off. Find an alternative reward. Sit out the anxiety or the craving, which they say lasts about 20 minutes, and then work your way up. Expose yourself more. Use alternative rewards more, and then that shows over time when people engage in that harm reduction method along with behaviorism, like the deconditioning and the exposure, that over time they spend less time at the casino, they spend less money, they go less frequently, and it helps them work towards recovery. Techniques and tools. The first thing they say to do when you go into gambling is a bit abstinence-based. Stimulus control is cutting off their access to money and casino. That usually translates to them having like a loved one, a spouse, a close friend who's trusted. Take control of their bank card, their bank account, their cash, and just dole it out a little bit at a time, as much as they need to survive for like a week, 2 weeks, a month, to stabilize while in treatment. Control is gradually given back to them as they're able to insulate themselves with a support network, coping skills, and then work their way up their exposure hierarchy, which I'll show you. And then CBT begins. There's the cognitive element, which is addressing thought distortions. An example could be, if I just keep playing these slots, I'm going to hit it big and win $1 million. Most people do not. This is what the casino wants you to think. So challenging the thought distortions and the unhealthy thinking patterns while also providing support. Then the behavioral element would be the exposure. The exposure and response prevention. So experiencing the craving, not giving in to play the slots or do the scratch off, and rewarding yourself in a different way. So here at the bottom, this is a SUDS hierarchy, subjective units of distress. At the bottom would be something not as triggering, like hearing a bell or seeing a flashing light, which you'd see in a casino. At the top, maybe standing directly in the casino, which would be super triggering. And then as you're working up the hierarchy to get more triggered, you want to provide increasing rewards for yourself. Those rewards would be determined by the person. Maybe up top it's a trip to the beach. Maybe at the bottom it's eating a brownie or whatever is like healthy and rewarding for them. Okay, goals and objectives. Reduce gambling behaviors. So they want to do exposure and response prevention therapy with therapeutic support. And especially at first, the therapist should be on call to do phone coaching when the client's triggered. Goal 2 is to reduce their psychological distress. You're going to go off of the BSI assessment. You're going to re-administer that throughout treatment to measure their psychological distress. You're also going to use cognitive restructuring, which is challenging the thought distortions and also helping them sort of change the way that they view their addiction and themselves to increase self-esteem. And then continue medication management, especially for already, pre-existing mental health conditions. They say SSRIs are very good at at helping reduce problem gambling behaviors. But if this person already has schizophrenia, they're probably on different meds. You want to see how those would interact with SSRIs. Are there contraindications or negative interactions? And would SSRIs work appropriately for this person if they have schizophrenia? And improve quality of life. So this is where GA can come in. This can help the person identify sober supports, a sponsor, feel validated, feel heard, connect with people who have a similar struggle. And then to improve quality of life, identifying alternative rewards and teaching them different coping skills to feel good and to calm distress. Okay, time and sessions. So we already kind of talked about this, but you want the sessions to be weekly, CBT with a therapist, phone calls as needed. And what was really interesting about the literature I was reading is that treatment seems to need to be ongoing indefinitely to maintain sobriety. They were saying that for gambling addiction, but I know also in just some of the readings, in videos we've had to watch for class that once that pathway is made in the brain, it doesn't necessarily go away. You can definitely decondition yourself and you can be able to hear bells and whistles and see the flashing lights of a casino and not necessarily have that intense craving. But the fact that that neural connection once existed in your brain, I don't think that ever goes away. So it's just a constant need for accountability, CBT. Doesn't have to be weekly for the rest of your life. I'm sure that as you achieve sobriety, the contacts can be cut down, but the authors of the different studies I was reading, they just emphasize it's important for it to be ongoing and to have homework to continue exposure. The strengths of CBT. It really helps people. It's equally as effective whether or not you have a mental health condition. So if you've got schizophrenia, major depression, bipolar disorder, and gambling addiction, CBT is still going to work for you, which is very encouraging to know because the rates of comorbidity for people with gambling addiction and major depression are high. That's at I'm looking for the number for you guys, 82.5%. That's super high. So it's encouraging to know that even if you have a mental health condition, CBT will still work for you. It's helpful in reducing the gambling behaviors, breaking the association, build self-awareness. Weaknesses. It's not effective for people with intellectual disabilities. There's a really strong cognitive component that requires some degree of needing to look inwards and self-reflect. And if you have an intellectual disability, it may vary your ability to do that. It also The treatment should ideally, for best results, should be ongoing. This requires ongoing access to therapy, which not all people have. It can be pricey or just not accessible, period. CBT also doesn't address all of the family dynamics involved in addiction. So sometimes, the family dynamics can be re-triggering for people or can cause distress, which CBT doesn't address always directly or thoroughly. Oopsies. Sorry, guys. Okay. Methods of evaluation. You're going to want to use the same exact ones you did in the beginning, except for the structured clinical interview. So I linked them here if you guys ever need them in your practice. I don't know. They're super easy to look up. And they're not too difficult to administer either. Some of them are super short. But you want to use the same ones, and you could even use them periodically. You could do it quarterly or biannually to check in with your person to see the progress that they're making or how effective you are with your CBT interventions. So you would just re-administer these and see if their scores are going down, and then implying that they're getting better, or if the scores are going up or remaining the same. Prognosis. So these are the factors that are going to influence recovery: continuing weekly CBT sessions, continuing exposure, using the SUDS hierarchy, making sure that they identify alternative healthy rewards so they can activate the dopamine reward system. It would be terrible if they just went up that hierarchy, triggering themselves more and more and more without any reward period. And then experiencing that dopamine depletion is a terrible feeling, and we wouldn't want that. We would want to support them with alternative rewards. And then maintaining medication management for mental health symptoms, ones that were pre-existing. Looking into SSRIs if they haven't before, or just continuing on the medication regimen they already have. Something to note, high anxiety is correlated with high dropout rates. So in the beginning of treatment, when you're administering the brief symptom inventory, it's going to let you know, if somebody's scoring high with anxiety or mental health symptoms that resemble anxiety. So if you have somebody like that, just keep in mind they're at high risk for dropping out. So what you can do if you identify somebody with high anxiety in treatment, you can provide additional phone contacts. You can immediately begin with relaxation techniques. From the beginning, that could be some of the very first things that you do, rather than jumping into exposure or talking about the hierarchy or working on self-awareness. You can just start with relaxation techniques and then identifying and building support networks sooner rather than later. You could sort of flip the order of that for folks with anxiety. Okay, so these are the studies that I picked out. CBT for problem gambling. They showed that CBT is the most effective intervention for reducing problem gambling. The emphasis is on the behavioral aspect, and then cognitive restructurings interwoven. SSRIs are also effective. Homework and relapse prevention are crucial to maintaining recovery. Pathological gamblers respond well to CBT was the second study that I read. It talked about the high comorbidity for other mental health conditions, and this study showed that even if you have a mental health condition, CBT is equally effective for you. And then these are my references to the two studies that I used. So thanks for listening in, guys. I feel like I learned a lot about the nature of gambling, and this would be the recommended treatment for somebody with gambling addiction, even if they have a mental health issue like our person did that we talked about in this study. So thanks for listening in. I appreciate it.